We are very sure that by now you are an expert when it comes to your labor and delivery. You know everything about dilation and contractions, you know how to breathe and how to push during labor, but then you finally push that baby out and you're like, oh, what happens next?
Exactly. So in this video, we are going to explain what will happen to your baby right after birth, and we are also going to discuss if there is anything that you can do to support your baby after birth.
Yes, this is Nathalie, a pregnancy and birth consultant and TCM therapist.
And that's Mathias, a researcher and Science Geek, and we help expecting mummies and their babies naturally and science-based.
It's great to have you here. Let's get started. So obviously one of the first things that are going to happen is that your baby's going to take that first breath. Right now, you have probably seen in countless movies that baby slips out and immediately starts to cry, right? In reality though, that may not happen. Some babies are super quiet when they come out. I still remember when our son was born, he was like, what the help me get back in there. But he was so quiet, right?
Yes, he was. He only started to cry once they started rubbing his back.
Yeah.
And they did that because they wanted him to take that first breath.
Exactly. Before birth, the lungs are not used to exchange oxygen. The lungs are filled with fluids. So circulation-wise, most of the blood is sent away from the lungs. But when a baby starts to breathe, then there's going to be a change of pressure in the lungs, which helps redirect the blood flow. So now blood is pumped to the lungs to help with the exchange of oxygen.
Exactly. Some babies just have a lot of fluid in their lungs. And so stimulating the baby, for example, by rubbing their back or by massaging them, can help bring up that fluid. So if your baby is not crying straight away, don't worry. Under normal circumstances, all that it takes is some stimulation, but that is not your task. The medical team is supposed to do that.
Yes, and then another thing that is obviously going to happen is that they're going to cut the cord. So your obstetrician will clamp the cord and then cut it in the middle, right? Don't worry, that is not going to be painful, neither for you nor for the baby, because there are no nerves in the cord, right?
Yes, and by the way, most health authorities nowadays recommend delayed cord clamping, which means that doctors wait until the cord stops pulsating. And they do that for several reasons. For example, because it boosts hemoglobin levels and iron stores in the baby, and it also increases circulation and the amount of red blood cells in the baby.
Exactly. And cutting the cord is something that your partner can do if they want to. But they should only do it if they feel comfortable with it, because we know many husbands who fainted when they cut the cord, right? So that's that. But it's not that bad. When I cut our son's cord, it very much felt like cutting through a garden hose, at least in my opinion, right? Anyways, and then of course they're also going to clean your baby and check the vitals of your baby. So this includes things like checking baby's temperature, heart rate, respiratory rate, as well as baby's weight, length and head, right? They basically want to know if the measurements are normal for the number of weeks of pregnancy.
Yes, and they're also going to rate their baby's overall well-being according to the APGAR score. In order to calculate the APGAR score, they're going to rate your baby according to 5 factors: skin color, breathing, pulse and heart rate, movements and muscle tone, and baby's reflexes after giving certain stimuli.
Yeah.
Your baby receives up to 2 points on every factor, and the sum of those 5 numbers is the APGAR score.
Yes, so the highest possible score is 10, but babies rarely score 10, right? In fact, a score of 7 to 9 is considered high, but even if baby score is lower than that, it does not necessarily mean that something is fundamentally wrong, right? For example, a perfectly healthy baby could have a low APGAR score when the delivery was very difficult and stressful for the baby, because the score just reflects the post-delivery condition of the baby.
Right.
And that is why they do the test twice, namely 1 minute and 5 minutes after the delivery, so that they can see if there is an improvement. Still, in very rare cases, a baby may require special attention and care if the score is very low, or if your baby is very small or very large, right?
Exactly. And another thing that is going to happen is that your midwife will ask you if you would like your baby to receive a vitamin K supplement, and if you do, whether you prefer it to be given by injection or by mouth. Actually, this is something that your midwife should discuss with you already during your pregnancy. However, we regularly meet women who are not being informed about it, so they don't know why a baby requires vitamin K.
Yes, so what vitamin K does is it basically helps the blood to clot to prevent bleeding. But because of their nutrition, babies receive only very little vitamin K. In addition, their liver is relatively immature and thus less able to produce other essential blood clotting substances, right? And because of that, they run a small risk of developing vitamin K deficiency bleeding or hemorrhagic disease, right? And that is why health authorities recommend giving them vitamin K right after birth. So you will have to tell them if you want that at all, and if so, whether you prefer an injection or by mouth.
Exactly. And just that you know, all those things that we just mentioned, like vitamin K injection, the APGAR test, etc., are normally done while you do the most important thing of all right after birth, and that is holding your baby. And this is when you will come into play. Up until now, your role has been quite passive, at least since that baby was born, right?
Yeah.
But now they will play the ball back to you. It's time for the bonding to start.
Yes, so this is when your baby will be lying on your tummy. Or if you had a C-section, baby will be lying further up in your arms, right? And that skin-to-skin contact must not be underestimated because bonding comes with so many benefits for both mother and baby. It regulates baby's heart rate and breathing, it stimulates digestion, it regulates baby's temperature, it stimulates the release of hormones to support breastfeeding and much more.
Exactly. And that whole process that we just described is supposed to be complemented by the first breastfeeding attempt of the baby. Keep in mind, the baby has never done this before. And if this is your first pregnancy, you have most likely not done this before either, right?
Yeah.
So please don't be discouraged. Let your midwife guide you.
Yes, you will get there eventually. And by the way, another way how you can support your baby is by different kinds of positions while breastfeeding your baby. For example, if your baby tends to be gassy or suffers from reflux or other kinds of problems, then a different breastfeeding position could help with the problem.
Right.
We explain the most important breastfeeding positions and how they can help your baby in the video that hopefully pops up now. If it does not pop up, you can also find it in the description below this video.
Right. If you have found this video helpful, we would be super grateful if you could leave us a like below this video.
Yes, and for more useful tips and tools on pregnancy and baby related topics, make sure to subscribe to our channel and to hit the bell.